Kwe Tanse Unusakut. Good morning et bonjour. I am here today with Associate Deputy Minister Valerie Gideon and Chief Medical Officer of Indigenous Services, Tom Wong. Tom, you'll be offering comments. Right? First, I'd like to acknowledge that I am here in Ottawa in the traditional territory of the Algonquin and Anishinaabe people. I want to start off by thanking once again Indigenous leaders and leadership across the country. You have been guiding your communities through extraordinarily difficult times, and I want to spend a couple seconds to recognize all your efforts. Over the last week, I've had the chance to speak to many leaders who are fighting COVID on the front lines, including Chief David Munias of Cross Lake. Despite outstanding work in the remote community and deploying vaccines under difficult conditions and fighting many waves of COVID, they're currently fighting an outbreak among the very young. So it's with great joy, obviously, that we welcome the news that Pfizer will be available to children that are 12 and over, including kids in Cross Lake. And to people who are still taking this lightly, I remind you of a conversation that I had with an Indigenous woman a little over a week ago who lost her mom, her dad, her two brothers, her son, and most recently her husband. This pandemic isn't over, and we can't let our guards down. I'd also like to take the time to thank all the nurses across Canada, including those working tirelessly in Indigenous communities, and in particular the 800 nurses working 24 hours a day, 7 days a week for Indigenous Services Canada, and often under very, very difficult conditions. This week is National Nursing Week. It probably should be National Nursing Year. And this year, it's been as important as any time in our history to honor nurses who are doing an extremely demanding job, done selflessly, and often without the recognition that is due. You're answering the call tirelessly on the front lines, bringing light to people that are in their most desperate hours. And I, Canada, can't thank you enough. Recently, Nunavut has seen an increase in active cases, an alarming one. And as of May 12th, there are 69 active cases in Iqaluit. This is a concerning situation, and our government has taken swift action to respond. Yesterday, the Prime Minister announced more than $19 million in funding to the government of Nunavut and Nunavut Tungavut Incorporated. These funds will be used critically to support families in isolation, support food security, assist with essential municipal services, provide supports for remote learning, and enforcing public health orders. This is made possible to the cooperative effort among Inuit communities, organizations, and partners to protect communities in the region. Vaccination efforts continue importantly in all 25 communities in Nunavut. We're confident that the number of active cases will decline with all the effort being deployed. But until they do decline, we will be there to help communities as they deal with the impacts of these outbreaks. Across Canada, as of May 11th, a total of 416,106 vaccine doses have been administered in 690 First Nations, Inuit, and territorial communities, and 134,740 of those were second doses. This represents about 68%, a little over 68% of Indigenous adults living on reserve or in the territories. In BC, FNHA, the First Nations Health Authorities, reported that as of the end of April, over 880,000 First Nations people had received their first dose of vaccines, and more than 10,000 First Nations people had received their second dose. In Manitoba, there was encouraging development last week as the province announced that all Indigenous adults are eligible to receive the vaccine now. And the First Nations Pandemic Response Coordination Team has reported that 70% of First Nations people in the province have received at least their first dose, which is extremely encouraging. In Yukon, almost 75% of eligible people have received their first dose of a vaccine, with 60% critically of those having received both doses. In Quebec,
three clinics recently opened in Montreal to serve First Nations, Inuit, and Métis. A big thanks to my friend Philippe Meillard, Executive Director of Native Montreal, who played a big part in advocating for the clinics. And our department is helping to support these clinics as we've deployed nurses to take part.
In First Nations communities on reserve, we're aware of 820 active cases, close to half of those being in Alberta, which brings us to a total of 28,118 confirmed positive COVID-19 cases. There are 26,972 recovered cases and tragically 326 deaths. We're making progress with vaccination, and it's a relief to see the overall number of cases go down over the past 4 months, coupled with the enforcement of public health measures. The trend over the last few days has been not so good, so we need to reverse the upswing by not letting up or being complacent. C'est toujours important d'écouter.
It's still important to listen to the advice of public health officials. Please continue to wear your mask in public, avoid large gatherings, practice physical distancing by staying 2 meters apart in public, wash or sanitize your hands regularly. During the pandemic, we've all managed by simply doing the best we can, even when we didn't think we could give anymore. I think we've been through the worst of the times, so I know that we can hang in there a bit longer and make it to the end.
Nakumik, Marcy Cho, thank you. Et merci.
Bonjour.
Good morning. First, I would like to acknowledge that I am on the unceded territory of the Algonquin people. During National Nurses Week, I would like to recognize and commend the tremendous sacrifices that nurses make every day to help protect the health of Indigenous peoples and other Canadians.
During the National Nursing Week, I would like to recognize and commend the tremendous sacrifices that nurses make every day to help protect the health of Indigenous peoples and other Canadians. The vaccine campaigns in Indigenous communities across Canada have been encouraging. As of May 11th, over 400,000 vaccine doses have been administered in 690 communities. And there have been a number of positive developments in the past week. Last week, Health Canada has amended the authorization of Pfizer-BioNTech COVID vaccine for use in those aged 12 and over. In the Northwest Territories, vaccination for youth 12 years and older have begun in Yellowknife. A youth from Ganawake, Quebec, stated that she wanted to get the vaccine. Why? Because she believes it is the right thing to do to protect herself and her community against COVID-19. An Indigenous youth who received her vaccine in Toronto stated, "We want to survive in this pandemic. We want to keep our generation strong, and we want to be able to do that in an environment that's culturally safe and culturally based. Let's vaccinate and race towards the light at the end of the tunnel." Miigwech nakumik marsi.
Okay, we will now take questions from journalists. One question, one follow-up. We'll start with questions over the phone. Operator, over to you.
Thank you. Please press star one at this time if you have a question. Veuillez s'il vous plaît appuyer sur étoile 1 maintenant pour poser une question. Our first question is from Dane Patterson from APTN. Please go ahead. À vous la parole.
Hi, Mr. Miller. The Indigenous Services Canada, as well as public health officials across Canada, have been saying that Indigenous people are vulnerable and at high risk for COVID-19. What will ISC do after the pandemic to address issues in Indigenous communities on and off reserve that have led to higher infection rates?
This is an excellent question, and it guided a number of our thought processes in the budget. We talk a lot about vulnerability and historic vulnerability, but we're also, we're also talking about communities that are proud, resilient, and strong. The conversations that I've had with any community leadership, sometimes in the midst of an outbreak, deal with infrastructure, most notably in and around housing. Those discussions that advocacy of leadership around the country informed the budgetary amounts that were announced in the budget 2 weeks ago, including $6 million in infrastructure to continue on that pace over a 3 to 5 year period in closing that gap. It is that gap and the consistent underfunding and undercapitalization of infrastructure that has driven that vulnerability that puts Indigenous communities 3.5 times to 5 times more vulnerable to COVID, as well as the comorbidities that have driven up and that communities fight against on a daily basis to keep their people safe. So as we've seen throughout COVID, we've had to deploy more measures into Indigenous communities of a health nature than we would have had to in non-Indigenous communities, because often those communities are more vulnerable to getting overwhelmed quickly through no fault of their own, as well as suffering after effects and the numbers in ICU and hospitalizations bear witness to that we see. So when we talk about all of the investments that we need to rapidly, once the budget is passed, and even before, with some of the monies that we have in Indigenous Services Canada, to start working with communities to prioritize their needs. Obviously, looking at these investments through a health lens, I think, has focused the minds of all of my colleagues in cabinet, as opposed to simply looking at these investments through a classic brick and mortar approach. So, obviously, I can say this from a podium in Ottawa, but people want to see that hit the ground, and that's something that we'll be working on as hard as we can over the summer, and getting monies out, investments out, and ensuring that communities' priorities are well articulated and reflect the needs that they've been pushing forward to us for such a long time. Minister Hussein's rapid housing investments was well oversubscribed, in part by Indigenous communities that will also have some residual needs, and that's why the budget also had a re-up with respect to those amounts in terms of rapid housing, because when we talk about the R rate being under 1, but how do you keep that under 1 when the household has 5, 8, 10, 15 people in it? The math just sort of proves my point. Anyway, excellent question. Thank you.
Do you have a follow-up?
Yeah, a couple of years ago, there was a Senate report that estimated the cost to fill the housing deficit would be between about $3 and $5 billion. Do you think the amount put in towards the federal budget this year will be able to cover the costs of increasing housing at the rate it's needed?
So I missed the first part of your question. Muddled.
Oh, sorry. In a Senate report done in, I believe it was 2017, they estimated the cost to fill the housing deficit on reserve would be between $3 billion and $5 billion. I'm curious, being put towards housing on reserve is enough to fill the need at the rate that it's increasing.
Yeah, I'd have to relook at that report. It would sound low that we don't have a real sense of what the infrastructure gap writ large. I mean, housing is one aspect of it, and it is a very important aspect of it. We have, as a government, as you'd well know, the mandate to close the infrastructure gap by 2030. Part of my mandate in the very short term is to measure that, and that number seems low. But I'd have to go back to it and see what it referred to over what period. Clearly, there is a gap. We see it. There is an increase in the population compared to the non-Indigenous population that is larger, and the commensurate housing needs. We have a sense of what that is, and clearly closing the 2030 gap was not the specific objective of this budget. The specific objective of this budget was to proceed to stimulus within a 3 to 5 year time frame, knowing that there will be a lot more work to do, and that number doesn't surprise me, but I'd have to go look at what it referred to specifically.
Thank you, operator. Next question.
Thank you. Once again, please press *1 at this time for any questions or comments. Veuillez appuyer sur étoile 1 maintenant. si vous avez une question. We have no further questions registered at this time. Back to you.
Thank you. We'll now take questions from the room.
Hi, good afternoon. Mia Rabson from the Canadian Press. I'm just wondering if you have any understanding of the impact on Indigenous communities, either urban or on reserve or in the territories, of this AstraZeneca situation. Most provinces not giving out many more doses. There aren't many left. Is this going to have an impact on getting further vaccinations to Indigenous people in Canada?
Not yet. We haven't. The vast majority of vaccines that have been administered have been Moderna, with some optionality in around Pfizer. Pfizer's been gotten a lot easier to deploy logistically, so it hasn't affected that. It is, in terms of the suite of vaccines that we have available. Obviously, right now, given the volumes, the workhorse is Pfizer. Very early on, because of its the ease of deploying Moderna, the territory has got, for the vast majority, Moderna. Now we're sort of given the youth population and the recommendation to go for 12 and up for Pfizer. We're reworking our logistics to make sure that communities that have large youth populations have access to the Pfizer in relatively short order. But it hasn't affected our thought process.
You also said in your opening statement that there have been some alarming signs in the last week or so. I'm wondering if you could explain a little bit more about what those signs are and what's causing it.
Yeah, I mean, I think as we look at the high vaccination rates in Indigenous communities, and they're really encouraging, and they've played alongside a parallel path of public health measures and just clamping down on everything that we've been talking about over the last year and a half. We've seen some amazing signs. I mean, the vaccination and the public health measures are really stomping the curve, and it's great. It's great to see. The challenge we see is within the flare-ups and increasingly in the unvaccinated. So there are stories, obviously, out of the Northwest Territories in schools about spread. So they've gone to online learning. In Cross Lake, as I'd mentioned in opening, there's an outbreak among the youth. And then we see, despite all the measures being put in place, the spread in Iqaluit, where all the precautions were observed, the person went into the community, and then things just got out of hand, and that happens. And we just got to be able to react quickly, and the same procedures that we've been going through the last 15, 16 months is to react, respond, track, trace, and isolate as quickly as possible, and then ensure the vaccination rates are up. But I guess it's a lesson that we won't be protected till everyone is protected. What if there's any lesson to be learned from prior epidemics is when it comes to Indigenous communities specifically, there is always a capacity for very important, significant flare-ups after the fact, long after the epidemic is an afterthought in sort of the more populated areas, in urban areas. They're the collective conscience of Canada, and that's something where we'll have to, the COVID responses supports that we got throughout the budget. They are profiled over 2 years specifically so that we can respond to needs in communities should the need arise and move quickly. Because if we don't move quickly, it spreads very, 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 very rapidly. So those are kind of informing our decisions. And the alarming, whenever you have a highly, as Dr. Tam would say, or Dr. Wong would say, whenever you have a highly vaccinated segment of the population, and then you start to see a flare-up, you start to ask yourselves questions. And it's sort of confirming the fact that we can't let our guards down. And despite the fact that people are highly vaccinated, those that are most vulnerable and not vaccinated, we have to kind of have a protective circle around them. And that includes, for now, is in the very young.
And say good morning, or good afternoon, pardon me. Chris Nashkate, CTV National News. I have a question here, and it'll just go to whoever can answer it. Nearly 50% of eligible Canadians and 16 and up now have at least one dose, and that number is higher in the territories and many Indigenous communities. The Prime Minister yesterday said this is going to be a one-shot summer, but no guidelines have been released about what that actually means, what rules do you believe can be relaxed safely with only one dose?
Yeah, and excellent question. We don't know yet, is the honest answer, and it is the one that we need to remind ourselves as we track a greater uptake of the vaccine. The point the Prime Minister is making is that if we want to even contemplate a relaxing of measures, people need to go out there and get vaccinated. And if you look at the profile of the volume of vaccines coming in, many people will be well on their way to that second dose. And you've seen people sort of toy with ideas. You've seen, for example, some of the work that's been done in Great Britain or in Israel as to some of the progressive measures that are being taken. We're putting a lot of thought into it, but we really need to drive the global numbers down to an acceptable rate before we can even make any public announcement as to what that relaxing would be. That's work that needs to be done with the provinces and territories and Indigenous communities taking their own decisions as they see their vaccination rates go up. And what we don't want to see is a repeat with the first wave. Things got driven down, and then people relaxed too early, and with the second wave, and then the third wave that hit. So I don't know, Tom, if you have some thoughts on that.
Yeah, indeed. I echo what the minister just said. We have to be doing this gradually, relaxing the public health measures. You've seen, during both the first wave and the second wave, when certain parts of the country, when they were reopening up too fast, the virus, will just hang on to, the community and the people were most vulnerable in particular. And so that's something that's so important. It is also important to consider for the communities and for the public health officials to look at not just the vaccination rate in adults, but the vaccination rate now that it's authorized for down to age 12 and up. So in the teens and in the future, there are possibilities that, if the trials, do actually show that it is effective in even younger, that's even better. Why is it so important? Because in many First Nations, Inuit and Métis communities, it's generally younger population than the general Canadian population. So therefore, we have a younger population still not protected. And so they can get infected, even though they may not be so sick in general, with the viral infection. However, they can spread. So therefore, it is so important to look at not just the vaccination rate in the adults now. We have to look at the vaccination rate, in the 12 to 17, as well. And at a certain point, when there's, very small number of infections in or around the communities, I think that, that's the kind of, time frame when communities working with the provinces and the territories and the public health officials jointly can actually, think about a gradual, stepwise approach to opening things up.
Thank you. Do you have a follow-up?
I have a follow-up, yeah. What is the individual and community risk when the vast majority of people only have one dose? In addition, do you believe communities with vaccination rates higher than the national average will be allowed to reopen earlier? I know it might be some overlapping there, but whoever wants to answer that.
You're not fully vaccinated until you get your second dose, and just look at the percentages. Whether a particular community that is more highly vaccinated can start to relax, will always be. Those are. Hesitate to think whether that's a real live example, because those communities that have been highly vaccinated have been also taking this thing very seriously. So they'll probably be very cautious in opening up and taking the measures to keep their people safe. it'll be gradual. It won't be sort of, you open it all up and you have a big concert. It just doesn't work that way. There'll be some trial and error, I think, associated to it. Throughout this pandemic, I think for all Canadians, we've seen Indigenous communities leading the way. So I think we'll be inspired, frankly, by some of the success stories. We've seen some really good work being done in immunizing and in being culturally respectful. If you look at the work that Saskatoon Tribal Council has done in Saskatoon at being welcoming to everyone, the police chief got vaccinated there. People feel great coming out of the clinics. It goes from a less sterile environment of a mass vaccination clinic to something that's welcoming, culturally appropriate. You see that time after time in community, or people going door to door. So all these models are transportable into bigger urban settings. So I guess my point to that is I think we'll see Indigenous communities lead the way. But up to now, the Indigenous communities are the ones, in my mind, that have taken this with utmost seriousness. So I expect to see some good news stories coming out of there. But I don't think we'll be recommending loosening that'll at speeds that aren't appropriate. There'll most likely be some work with provinces in and around guidelines and opening up, and there'll certainly be some trial and error.
Next question.
Hi everyone, David Thurton, CBC News. About a month ago, we were presented some modeling from Dr. Tam that shows that if 75% of Canadians get at least one dose, and I believe 20% get a second dose, that we could see a gradual lifting of some of our restrictions without this crazy spike in cases and hospitalizations in the fall. I'm wondering if you've done similar modeling for the territories, other Indigenous communities. Can they also, does that also apply to them? Or are you looking at different figures or different modeling?
No, I mean, it's a very rough rule based on our best sense of the course of how COVID affects people. I mean, obviously with variants and higher transmissibility, it changes a bit some of the thought process. And then the more important question, David, I think, were you to apply that rule in a systematic fashion, what that relaxing could look like. So it's obviously not mass concerts or mass gatherings. It's slowly easing, opening up the bubble. We don't want, the experience with Israel is that they had to shut down after they've opened up a bit. We have a little more knowledge as to what's going around worldwide, but we need to get there, and that's the point the Prime Minister trying to make. Let's get there because we're going to get the vaccines, and we see what's going on in the U.S. with some stall, which is inevitable. But we're going to have to do this progressively, methodically, and slowly. So I think, when those rules come out, I think everyone will scrutinize them intensely to see whether they are the right ones, and we'll be monitoring those through testing and tracing, and really tracking flare-ups. What I mentioned earlier to one of your colleagues still bears true is that you can have, and we're seeing it in Indigenous communities where the transmissibility is higher for the reasons that I spoke to earlier. You still see it happening, and you still see it happening in those that are unvaccinated, and whether it's school settings, or playground settings, or gatherings, you can still transmit. So it's stuff we're watching very, very carefully.
So can you just maybe unpack that a little bit? Why does it sound like the bar is a bit higher for Indigenous communities when it comes to lifting restrictions? Is it because of the congregate living situation, the lack of housing? What is your concerns with lifting restrictions when it particularly comes to places that are reserves, the territories and stuff like that?
Well, I mean, it stands to reason that if you're 3.5 to 5 times more susceptible to be impacted by COVID and more negatively so, that you would be a little more cautious. So, communities know that better than I do, and their decisions to open up and close down will be theirs to take along, with the latest communication from our health officials and their own health officials. But it'll be a work of cooperation that has worked so far actually really well. So it's not a question of the bar being higher. You can kind of look at the data and say, should you take this decision, we'll work with you, and if and when it doesn't, we'll work some more. But it's always a cooperative process. It isn't a question of Ottawa imposing a higher bar. We just give all the information we have and work with communities. And they've, as I mentioned, your colleague, have been exemplary in clamping down and making sure they're keeping and protecting their own. And there's some great examples coming out of there. So I think, to the extent they're ahead of the curve, we'll be learning from them.
Great. We'll just turn back to the phone operator.
Thank you. Merci. We have a question. Nous avons une question de Laura Fortin de Radio-Canada.
Question, Laura Fortin, Radio-Canada. Good afternoon, Mr. Miller, Minister Miller. I'm asking you about vaccine hesitancy. Is that an issue right now in the Indigenous communities in Canada? Answer from the Minister. Well, it's an issue, but they have overcome it admirably to date. Whether it be vaccine hesitancy, which is well-founded because of underinvestment in healthcare in these communities, or the after effects that have been experienced by Indigenous through contact with the healthcare system. Vaccine hesitancy plays a role, and we have to take it into account in our approach. And that is taken into account in the vaccine rollout. To date, the vaccine rate is much higher in Indigenous communities, and there is very little vaccine hesitancy. It doesn't mean that people aren't hesitant, perhaps slightly, but this depends on enlightened decision-making and informed consent with regard to getting the vaccine. And I think that the models that have been put in place in Indigenous communities are an example for us all. I said earlier in English, I mentioned examples that we'd seen, whether it be in Saskatoon, in the urban community, vaccines that are given door to door with people who administer the jabs. And those are people who are well known and trusted in the community. And there can be more vaccine hesitancy in racialized communities. So you're wondering whether vaccine hesitancy exists, even though we don't see it in the figures. Definitely, it is something that we have to address. And given that it's National Nursing Week, we need to underscore the efforts that nurses have made throughout this pandemic to try and boost our healthcare system.
C'est bon, j'ai pas de questions de suivi, merci.
No follow-up, thank you.
Merci.
No follow-up? No, thank you.
Vote operator.
Merci.
Any
Once
more
again, please press star one at this time if you have a question. N'hésitez pas à appuyer sur l'étoile maintenant pour poser une question. And we have no further questions registered at this time. Nous n'avons plus de questions pour le moment. Back to you.
Thank you. We'll just turn back to the room if there's any more questions.
Yes, David, again, I'll try and be quick with this question. It's about line 5. The Anishinaabe Nation is saying that they released a statement last week saying that they are upset that the government is picking and choosing which treaties to uphold based on the convenience of profit rather than in good faith and health and safety, and it goes on. But essentially what they're saying is that in voicing the Canadian government in voicing its concerns about Line 5, it's invoking that 1977 treaty with the United States, and you're picking and choosing which treaties you want to enforce in reference to the history of the Canadian government not respecting its treaties with First Nations people. Is there an irony in that, Minister, would you say?
Look, I don't think you need to, and while I respect the nation's point of view on Line 5, I think you don't need to talk about Line 5 to realize that Canada is not respected its treaty obligations towards Indigenous peoples. It's not a matter of debate. It's a matter of historical record. Many of those are currently in court. What Indigenous communities that are that are part of treaty want us to do is to respect their sacredness and to engage on a treaty basis. Now, what that means is for us to discuss with the treaty partners on that basis, and not sort of assume that or interpret liberally to ourselves what it means, as opposed to listening and respecting the wishes and engaging in a way that is respectful and open. It doesn't mean we won't have disagreements, but when we disagree, it has to be respectful. So while we might have a difference of opinion on or view on line 5, it isn't intended to disrespect the nation in particular, and they're entitled to oppose it, and I respect their opposition.
So in this spirit of respecting the treaties, First Nations are saying that this line 5, violates their treaty rights to hunt, to fish, to gather. Not just First Nations in Canada, but First Nations on the other side of the border. So how is the government going to respect their treaty rights when they're clearly opposed, some are clearly opposed to this pipeline?
I think we have to talk about what that opposition means and talk about what respecting their rights means. It's not something that you kind of do in a media question. One person back, me to David from CBC. I have to engage with the community and speak to them about it. And look, it's my job and that of Minister Bennett's, and in fact, any member of the Minister of the Crown to do that. And we have many conversations whenever I can. There's a principled opposition to line 5 that is theirs, and theirs is one that I need to respect. Now we disagree as to whether it should continue or not. It is vital to Eastern Canada. Is vital to our national interest, but those disagreements can be done in a respectful fashion. It doesn't mean that I'm not going to argue with their perspective on this. So it's a matter of engagement and continued work with the nation in particular. These exist in any sort of discussion over anything in Canada where there are rights that are seen to be violated.
Great. Next question.
With CTV again. I want to ask you, Minister, just about status cards. We've seen a lot of stories in the news lately about it. I want to get your thoughts on it, if there's any updates to that. We have some families waiting 2 to 3 years for status cards, while others are getting it in with 1 to 2 months. It just depends where you are, maybe geographically or not. What are your thoughts? What's being done with status cards? What's being done to speed up the process? There's this petition that's in the House now with the help of the NDP. Can you kind of just update us where you're at with status cards and what's being done to speed up the process for families that are still waiting for status cards?
Yeah, I think there are, obviously there are cards that are issued by the band, and those are, you have to distinguish those as opposed to the secure status cards. I think and I'll pass it over to Associate Deputy Minister Gideon to complete my thoughts on this, but we do need to speed things up, and there has been a slowdown with people working from home, everything we've seen through COVID. My feelings on this and my views on this is we do need to speed things up. The service standard for someone that needs to get a secure secure status card, I believe, is around 8 to 12 weeks. Some cases for new cards, new applications have taken longer. When it comes to another matter that is related, and those are people that are affirming their status through S3, we've ramped up that with additional resources out of Winnipeg and out of Quebec City to increase the volume of applications and to catch up. I think I haven't looked at numbers recently, but I think we're getting towards about 1,500 a month, which is a good sign. But there's more work to do. Clearly, we can do better. This is something that I'll be keeping a keen eye on as we emerge from COVID and we start to ramp up our capacity at ISK. A lot of the times there's some difficult stories around getting people getting their card, but it seems like there's also some that seem like no-brainers that are taking way too long, so I get that. I don't know, Valerie, if you want to complete from your view.
That was a really comprehensive answer, Minister. I would just say there's a difference between accessing the status card and verifying the eligibility, right? And it is those very complex cases of trying to trace back the lineage where, we have to do all that extra effort to be able to confirm eligibility. But it's not the card issuance itself that's the barrier in those cases. So just wanted to add that point. And just what we are able to do with Jordan's principle, for example, is if it's a question of children, that are awaiting their eligibility, we're able to serve them under Jordan's principle, for example. So we also do work closely with our registration office to be able to look at ways in which we can support families.
A follow-up to that, in the petition, they were saying, can we get this status card done in 20 days or less, like a passport, like a Canadian passport? Is that realistic? Can that be done one day? Can we get to that point?
I'd sure like to see that happen. I think a passport is people already, as Valerie mentioned, that people already have their supporting documentation. So you're getting a proof of essentially what would serve as a proof of travel. That does serve as a proof of identity, but here's sort of earlier on in the process where you may have to be checking for supporting documents and verifying eligibility, which is a little more complex. I'd love to get it down to a lower time, but we have to also have the integrity of the process that has to be respected. And what is, getting a card is also can be a profound choice, which not entirely the same parallel as getting a passport. Maybe, with respect to some people that will never get a Canadian passport despite living in Canada for well before my ancestors did. But I do get that.
Thank you. And this ends today's press conference.